organism is the way it is. A bundle of evolved trade-offs shaped by natural selection, not even for health, but to maximize fitness. I often get the question, how is evolution going to change the practice of medicine right now today? How can doctors use it in the clinic? It's a very understandable question. We all want to improve health as quickly as we possibly can, and we want to invest in kinds of science that will help us do this. But trying to apply evolution immediately often implies applying it without thinking too much. Most of medicine is quite suspicious of theory, because grand theories of medicine often lead to trouble. Whether it's the theory that every disease is caused by constipation, or the theory of homeopathy, or any number of other theories, they tend to emphasize one kind of cause or one kind of treatment to the exclusion of other things and to the great disadvantage of patients. Medicine wisely avoids theory in general, and I'm afraid this has extended to a true theory that is truly foundational for medicine, that is, evolution. I'm not really in favor of clinicians starting from an evolutionary understanding and immediately changing their clinical practice. What evolution offers, however, is a whole new set of questions we need to ask and do research on. For instance, is it wise to give something to lower fever during influenza, or does that prolong the illness? What are the risks of vaccination in terms of its effects on the evolution of the pathogens that it's protecting against? The questions go on, and the rest of this lecture will address those questions. Once again, however, the application that influences doctors the most may not be the specifics. It may be their understanding of what disease is and what medicine is. Once you start looking at disease from an evolutionary viewpoint, you realize that the vast bulk of medical research has been asking questions about why people differ. That is, why some people get sick and why others don't. These are very good questions, and they are the key to preventing and treating disease for the most part. However, there's a whole other class of questions that needs to be asked as well. Why has natural selection left us vulnerable to disease? This isn't a question about why people differ and why some people get sick. It's a question about why all members of a species share certain traits that leave them vulnerable to disease. To try to make sense of this, George Williams and I suggested that there are 6 main classes of reasons that should be systematically considered for each disease. The first 2 reasons leave our bodies vulnerable because selection is just too slow. First is mismatch. With the novel environment, much of which we created ourselves, our bodies are simply not designed for the wonderful availability of luscious foods and lack of exercise that leaves us vulnerable to many diseases. Second, there's competition with organisms that evolve much quicker than we can. The third and fourth explanations are because selection is constrained. There are a lot of things it can't do. Every trait is a trade-off. It could be made better, but only at some cost that would make the overall organism worse. And fourth, there are indeed constraints on natural selection. It can never start over. The code that holds the information is vulnerable to mutations. There are many aspects of natural selection that leave us directly vulnerable because natural selection isn't better. The last 2 explanations aren't exactly reasons why we're left vulnerable to disease. They're reasons that we misunderstand. That is, organisms are not shaped, in fact, for health or longevity. They're shaped for maximizing reproductive success. And if a gene increases reproductive success, it will spread, even if it makes life shorter. There are several examples we'll come to in a moment. And finally, there are defenses of suffering. Pain, nausea, fear, vomiting, fatigue. They seem like medical problems, but of course they're not. They are protective responses that have been shaped by natural selection and whose expression is regulated. And they're expressed whenever it's worthwhile, which is usually when something bad has happened. They're not diseases, they're symptoms of diseases, and the distinction is very important. Now I'm going to go through each of these 6 reasons, giving just a few simple examples of each. I'm using many examples not fully explained in order to give you the gist of the idea. Each one of these examples would deserve a full 1-hour lecture if we were going to do it right, but there simply isn't time for that. I'm not claiming proof for any of these. The goal is to help you recognize the kinds of questions that Darwinian medicine asks and the kinds of answers that are considered as possible hypotheses ready for test. So number 1, our bodies were never designed to cope with this novel environment because selection is too slow. We can't change fast enough. This mismatch explains most chronic disease. If you were to make rounds with me in any internal medicine ward in a major university hospital, fully half of the patients there would be there because of diseases that they would not have gotten if they were living like hunter-gatherers. Essentially, all of the atherosclerosis, most of the strokes, most of the breast cancer, all of the complications of tobacco use and alcohol use, and many of the car accidents as well. You would simply not see any of those problems in people who grew up in a hunter-gatherer kind of environment. Of course, most people would be dead if they had grown up in a Paleolithic environment. We are not saying that it's better to live then than now, but it remains true that most diseases, chronic diseases at least, that we are dealing with now arise from living in a modern environment, and worst of all, we create environments that fulfill our desires. And it's those very aspects of the environment that most satisfy us that are most dangerous to us. Here's a frightening image. What's especially frightening is that for most of us in our coronary arteries right now, there are such atheroma gradually growing with each hamburger that we eat. We keep trying to stop ourselves and eat lots of vegetables and exercise all the time, but we don't do very well. Why do so many people get heart attacks and strokes now who didn't used to? Well, consider cholesterol levels of modern Americans compared with those measured in 3 other cultures where people eat less and work out more. The normal levels appear to be somewhere in the 120s to 130s, and those people very rarely get atherosclerosis, even in their 50s and 60s. It's no wonder atherosclerosis is such a problem now. Breast cancer is also vastly more common now than it was hundreds of years ago. Part of the explanation is certainly due to excess hormone exposure. In work by Boyd Eaton and studies by Beverly Strassman and others, they've shown that the number of menstrual cycles that the system is designed for is somewhere in the range of 100 to 120. That's because women have their first baby at about age 17. In that circumstance, that'll take 9 months, and then they nurse the baby for 3 years. They might have a few menstrual cycles before becoming pregnant again. They go on that way until menopause. With the advent of contraception, however, women can choose when they have children, and they often choose to postpone their children. This leads to a number of menstrual cycles in the hundreds, often over 400. There's another reason, however, that breast cancer is more common now, a very surprising aspect of the modern environment that encourages us to ask good questions about everything that's novel. It turns out that exposure to light at night might be a crucial factor. This was first discovered in the studies of blind Norwegian women. The ones who had melatonin levels suppressed at night didn't do very well. They were much more likely to have breast cancer, while those who had melatonin levels that were high, melatonin usually goes up in a dark room at night, and the melatonin seems to suppress the division of breast cancer cells and to decrease the risk of cancer. Studies of nurses who are doing shift work shows that they're more likely to get breast cancer if they're exposed to light at night, and new rat studies show the direct mechanism of action for this postulated cause of increased cancer rates. It seems like each week's newspaper has a new gene that's called a, quote, defect, unquote, accounting for one disease or another. So why do these genes persist? Well, many of them are not in fact defects at all. George Williams and I have coined the word quirks to describe genes that were not harmful at all in the natural environment, but they reliably cause problems when they interact with factors in the modern environment. Dramatic examples include genes that predispose to atherosclerosis, those that make us nearsighted, and those that make us vulnerable to drug abuse. The implication? Most genes that cause common diseases, chronic diseases at least, are not really defects. They're simply quirks that interact with factors in the modern environment. Myopia is a really dramatic example. The heritability of myopia, that is the proportion of variation that's accounted for by genetic variation, is 80 or 90%. What genes you have determine whether you get nearsighted or not. So why did natural selection long ago eliminate those genes? Well, it's because those genes didn't cause nearsighted centuries ago. In one interesting study done in Inuit peoples, very few people had nearsightedness until one well-meaning educators went in and began teaching children how to read, whereupon the next generation, about a third of them were nearsighted, just like in most other populations in the world. Here's another gene with an interesting effect. This one done with Margaret Burmeister's research group, and I was able to collaborate with her and Susan Sen and Helen Meter, a hypertension expert, to measure different variants of this gene and how that related to the amount of negative affect the person had. We found that individuals with the Val-Val allele of this brain-derived neurotrophic factor genotype had quite a lot more negative affect